Dr. Catherine Price, and I'm going to go over how to do a release of the Tensor Fascia Latae Muscle. And this muscle is a muscle group that I will release if there is anterior knee pain, or sometimes it can be a culprit to low back pain if there's tension in this muscle. And I'm going to go over locating the muscle and how to release it. So the Tensor Fascia Latae muscle is supplied by the superior gluteal nerve, and that's going to be from branches L4, the fourth lumbar vertebra, the fifth, and S1, the first sacral vertebra. So L4, L5, and S1. First, to find your Tensor Fascia Latae, you want to take your thumb, find the very front of your hip, that's your ASIS, so it's going to attach there. And then I'm going to find the trochanter, which is the outer bony portion of my hip, and I'm going to hold that position and then take my pointer finger, and right in the middle, that's going to be where my Tensor Fascia Latae muscle is. It is a hip flexor, and it is one of the two muscles that attaches to the IT band. IT band is a band of tissue that goes down the side of the leg, and the Tensor Fascia Latae is the muscle that attaches to it from the front, and the gluteus maximus attaches to that IT band from the back side. So if there's problems on the outside of the knee from the IT band, then this is a great muscle to release. So this is the Tensor Fascia Latae release. I'm going to use the lacrosse ball. I'm going to go onto my side and apply pressure right where I find the muscle, and I will lie directly onto my side. Then my top leg is going to be a stabilizer, so it's just going to go out in front. I'm going to apply pressure onto that Tensor Fascia Latae and then bend the knee. And as you bend the knee, you may feel the intensifying discomfort over that muscle. And then it is a rotator, the Tensor Fascia Latae. It flexes the hip and it also internally rotates the hip. So I'm going to drop my foot down to the floor behind me and then raise it right back up. So I'm going to move that muscle in the rotation while applying pressure. So again, to find the muscle, I'm going to find the front of my hip bone, the trochanter, the bony part that sticks out on the side, take my pointer finger, go right into the middle portion of that, place the lacrosse ball, angle onto the side so that I'm applying pressure directly onto that muscle, using my top leg for a balancing leg, and then bending the leg where the pressure is and rotating that leg once I've applied the pressure, and then straightening back out, and then bending, lowering the foot to the floor, bringing it back up and straightening back out. So this is the release for the Tensor Fascia Latae muscle, and it can be of benefit to address depending on what problem that you are trying to address. So I hope this is of help. Have a blessed day. Thank you.